All right, everybody, welcome to tonight's Q&A. We thought this was very timely, and I know a number of leaders had contacted us, contacted Jeremy, myself, about the possibility of getting some MYBA leaders, tournament directors, presidents, travel directors together to kind of discuss some very timely things, obviously, as you all are beginning the youth basketball season that is going to shape up very differently than anything that we've ever seen before. And we wanted to make sure that as members of the MYBA that you have the opportunity to openly ask questions, your concerns, and if our guest speaker tonight does not necessarily have a full-fledged answer, we can get the answers for you because he works hand in hand with a number of the state epidemiologists with the Minnesota Department of Health. I think just to be sensitive for everybody's time, we're gonna allow Jayme to kind of start with some talking points, some things that have happened recently that he's been working with the MDH on, some of the things that might be reminders to you. And then at the end, myself, Jeremy, and Rich will kind of end it. We're going to have Craig Perry hop on for just 2 minutes and let you all know again kind of the basic stuff of that GameDay Ready app that may be very beneficial for your organizations if you choose to use that for practices and games. Because I know a number of districts are asking for there to be contact tracing and attendance actively at each practice and any games that are happening. So I'm going to turn it over to Jayme. I just want to know there's one thing that he's going to kind of talk about, and it's related to the household. And there's some main things that he's going to discuss because there's some misnomers out there about it. We did update our guidelines, our back to the hardwood guidelines. We had some people look it over because the last time it had been updated was early July. And there is a big thing in the last page that Jamie's going to kind of talk about related to screening, assessment, and some requirements that you should do if things are going on within your household. So I'll turn it over to Jayme. Jayme, thank you again. You are awesome. You've taken a time out of your Sunday evening to talk to us, and we appreciate your assistance and help in this.
For sure, and thanks for everybody having me. I know I've spoken on here a couple times, but those of you who don't know me, Jayme Murphy, I work with the Minnesota Amateur Sports Commission. I will also work at the National Sports Center. I have a sports background. I played Big Ten football. I'm a 3-time letterman. I have a master's in public health and community health and epidemiology from the University of Minnesota. So kind of a interesting culmination of events that lead us here, where I basically work pretty closely with MDH and Commissioner Tomes. A lot of what I do is trying to kind of understand the guidelines. As they build new guidelines, try to root them specifically in sports using my sport knowledge to help their guidelines a little bit, and then again help communicate to stakeholders. It's imperfect, it's impossible to reach everybody, and I know it might not always sound like it. We're leaps and bounds ahead of other states and what they are doing to understand their guidelines. I know some of you may, if you're more familiar with kind of the national youth sports thing, you might have seen New Hampshire and Massachusetts both close their hockey rinks for 2 weeks. And after talking to some people from those two states, it sounds like some of these groups don't even have preparedness plans. They don't have any form of communication or understanding to know if they're following guidelines and what to do if they're not, or they have cases. So we're fortunate here. Again, it's not perfect. It can always be better. But we're really trying to get all these youth sports stakeholders, hockey, soccer, basketball, baseball, softball in the summer, and then honestly I'm learning a lot about other sports, whether it's figure skating, gymnastics, trying to road racing, trying to find how these guidelines work within these sports. So when it comes to these sports, you know, I can give more of let's say a general outline or kind of thought process on how you should be thinking about things. In terms of exposures and cases, that's when I can get more specific and really definitively tell you what to do. Another thing, just want to put on everybody's radar, in Minnesota, our cases are going up. We had, we're getting closer to numbers that more look like late May, early June than they have at any point. So, you know, I'm saying that because things could change in terms of guidance, in terms of how the state's gonna, you know, let's say limit or allow anything, and that's not just going to be sports. So that's just something to keep an eye on. So, you know, as with guidance changes. Unfortunately, you know, there's not going to be a single thing we can point to that's going to be evergreen. But this is a good start. And I shared a link in the chat to the decision tree. And hopefully you all can see that I just shared this here. If you have any questions, well, one, if someone's symptomatic, player, coach, volunteer, anybody, reference this decision tree. You'll see it breaks down symptoms as more common and less common symptoms. More common means, you know, more common of COVID, not just more common symptoms in general. So if anybody just has one of the more common symptoms, if you just have a fever greater than or equal to 100.4 degrees, if you have a new onset or worsening cough, if you have difficulty breathing, or if you have a new loss of taste and smell, that's an automatic reason not to have someone attend a practice or game. They are symptomatic. That individual needs to stay home, evaluate their symptoms. So let's say, we'll look at the blue box here. Either having one of those more common symptoms or you have a couple of the less common symptoms. And less common, the reason these are less common, you'll see these in other illnesses, other upper respiratory illnesses, colds. We're not as much into allergy season, but strep throat, things are out there that kind of will look like COVID and aren't COVID. So again, stick to these decision tree on how to determine what to do. So let's say I have a fever of 100.4 degrees. I either stay home or I'm sent home. You'll see here, this is really important. Siblings and household contacts remain at home and are sent home. So in terms of minding your household, if you have one person that is actively showing COVID symptoms, so this is something to think about your athletes. If they have a sibling at home that has COVID symptoms and has to stay home, your athlete should be home too. So, you know, that's an important piece. If you go seek evaluation here following the decision tree over for a test, let's say you get a negative test or an alternate diagnosis, everybody's back in your program. Let's say you have these symptoms and they persist, but you don't decide not to go get tested. They're asking you to stay home for 10 days. Essentially not getting tested while you have COVID symptoms. According to MDH, they'd treat you exactly the same as if you had COVID. So there's a little bit of motivation to get tested on top of kind of helping out everybody else in your household. But let's say you do receive a positive, then you go into these 10-day protocols. So a positive case, you have to stay home 10 days from your positive date. Your fever has to subside, and so do your symptoms. And as long as that's achieved, you can be back in business. If someone in your household, you know, what do they have to do when you have COVID? Bringing this decision tree up here. Siblings and household contacts stay home and have to quarantine from all activities for at least 14 days. So this is a point that MDH wanted me to stress a little. You know, if someone has COVID in your home, it's quite likely that someone else in your home might get COVID. And if let's say you have an athlete on your team, let's say mom gets COVID, and you know that individual has to start self-isolating for 14 days. Well, let's say 5 days into it, all of a sudden their sister also tests positive for COVID. Well, that 14 days has to start over. So then it becomes 14 days from the sister testing positive. So that's an important thing that I've seen, that there's some confusion out there, especially in the sports people I've been talking to. That 14 days can get a lot longer if multiple cases pop up. within a household. So if anybody's symptomatic, everybody, especially with these common symptoms, again, fever, new or worsening cough, difficulty breathing, loss of smell, everybody in that household should be home until those test results are returned. Cases are getting high enough and spread is high enough that this is the safe thing to do. I guess that'll kind of lead me into, let's talk about exposures in the sports setting, recommendations, requirements, and some cautionary tales. So if you have an individual at your practice that ends up testing positive for COVID or becoming symptomatic with COVID symptoms, and then they end up testing positive within 2 days of your practice. So let's say you have a practice or a game on Tuesday night. Everybody participates. Let's say on Thursday morning, you have an individual that either tests positive because for some reason they had to get a test because they're asymptomatic, or they start showing COVID symptoms and later test positive. Everybody at your Tuesday practice is considered exposed. Now, the recommendation is to take a 2-week break, treat everybody as exposed. Now, it is not a requirement, but is a recommendation. So giving you, let's say, a cautionary tale. If we had someone, for example, I won't name the sport, but we had a team that had one positive case. They determined that 7 people on their team had close contact. And the definition of close contact in sports is less than 6 feet for 15 cumulative minutes. Cumulative being the key word. You typically in social settings and normal settings, just normal social exposures, they're looking for consecutive minutes. You got to spend 15 minutes in a row with someone in close quarters. In sports, it's cumulative, whether it's 5 minutes in the locker room, 5 minutes in the car, and 5 minutes during the game. They all add up. So that 15-minute exposure it is kind of what they consider the threshold in sports. So continuing with that cautionary tale, we had a team. They identified one person who became symptomatic the day after their game and also ended up testing positive. They went contact tracing themselves, which is not necessarily the wrong thing to do. They tried to figure out who on their team had less than 6 feet of exposure for 15 minutes cumulatively. They determined there were 7 people who had that exposure, and they asked them to self-isolate, and they continued to play. They had a game against another team. To give them credit, they were completely transparent with the other team about the situation, how many people they had to isolate, who had a case, when everything happened. Asked them if they were comfortable playing a game. That team said yes. This was more of a competitive, let's say, league. And so they both agreed to play. Well, it turns out 7 days later, the team that only had one case and decided to self-isolate 7 individuals ended up having 14 cases on their team. Wow. So, and it was a mix. Some of the people that they had self-isolated were positive. Some of them were still playing on the team that they didn't determine. So what I'm really trying to get across here is our ability to kind of understand who's exposed based on 15 cumulative minutes and less than 6 feet. It may be inexact in the sports setting. 15 minutes is an average. That's how they come up with that number. But it can only take one instance of really, having a lot of air particles in someone else's face, whether you come chest to chest with someone, whether you're guarding them. Who knows? It's a peculiar virus. It's crafty. It finds a way to get to people, and it's really unpredictable. Sometimes it doesn't spread at all. But you can see where you might think you're doing the right thing, just picking out who you thought was exposed. But it's not just about what happens in this case, with you guys on the court. It's everything else. It's transportation. It's any socialization these individuals are doing afterwards. It's locker rooms, any congregation spot throughout the whole process that comes with sport can lead people to be exposed. So that's a long-winded way of saying that's why the recommendation is if you have a person who in that 48-hour time frame prior to becoming symptoms and then testing positive, practice or played, the recommendations to take your whole team on a break for 2 weeks. Treat those individuals as exposed and have to self-isolate. Now, I get that that sounds like a lot. I mean, one thing, you know, it's the risk of not doing so can be pretty high. And more importantly, you know, there are, can be, you know, we're seeing health effects from people with COVID. A lot of people seem to recover well. But more importantly, there's a public relations thing at play here where we have to protect ourselves and each other in youth sports. The last thing we want to do is be on the front page somewhere saying that we had an outbreak. We had 10 cases, we had 14 cases, and really start, let's say, turning public opinion against us. I mean, that's really important here, to kind of mind our own backyard and each other. You know, we're in this together. Most importantly, we want to play sports for the kids. We want our youth athletes to be able to get physical activity, to be able to get out of the house, to have something to do, to have some sort of normalcy. And there are lots of trade-offs that we have to make as, you know, sport administrators, league administrators, coaches, parents, and all that. You know, Dawson did a good job describing this. It's not going to be normal, but we can all do our best to protect, one, our athletes, and you know, two, our organization, and three, our broader sport. So those are, you know, some really, really important considerations to take into account when thinking about how you are going to ask individuals or, you know, that are exposed to self-isolate. So, I mean, to kind of reiterate, the two biggest importantly threats to your team and to us broader sports. It's one, it's these household exposures. Parents are getting exposed at work or other settings, or brothers and sisters are. Your athletes have to be mindful of their household. And two, just kind of this larger exposure at play. I understand that the requirement is not to shut down your whole team right now, but the recommendation is. So I recommend following the recommendation. It's safer for you, your athletes, and the broader sport. So first, you know, I have this decision tree. They kind of walk through this exposure process right here on the bottom. This is pretty straightforward. I would utilize this when trying to determine what to do for anybody symptomatic, anybody exposed. They ended up actually coming out, usually with guidance, they'll come out with the memo or FAQs. FAQs being facts and questions, specifically about this guidance. And some clarification here that I think is important to make. So if someone in the household's asymptomatic and is being tested for COVID, the other children are not being tested, they do not need to stay home from school, and in this case, or sport. And so what this, really good practical example that I've seen of this is, let's say dad had a exposure, I'll use a really specific example, in the duck blind last Saturday. And his hunting buddy ended up testing positive shortly thereafter. The dad kind of knows he was exposed, but he has no symptoms at all. We're only worried about the dad right now. If he goes and gets tested while he's waiting test results, the kids do not need to stay home. They can go to practice. Now, you can see how this can flip on its head really quick. That dad tests positive, instantly those kids got to be home. So it's the way I like to look at it. I don't know if anybody, it's like the Kevin Bacon game. The degrees of separation, we're really only worried about 1 degree of separation at one time. You know, one step at a time. If this person is asymptomatic and they were exposed, we don't worry about everyone down the line till that person tests positive. So hopefully that's like kind of an easy analogy to understand. I understand that this is tough to wrap your head around. If we were being absolutely as safe as we could be, everybody would stay home. But our governor and the Department of Health are kind of negotiating some different ways to allow for some freedoms with knowing how this disease transmits and exposes people. Second piece here, again, important about households. If someone in the household symptomatic and is being tested, everybody should stay home. Don't attend school, childcare, or sports. If that test result is negative, everybody can return. If the test result's positive, everybody should remain at home and begin a 14-day quarantine period. That period should be from, if it's in your house, from 14 days of the positive test date. And so that person with COVID can come back when they feel better, symptoms have improved, and it's been 10 days since their positive test. So that's how you get back, and part of that not having symptoms is without using medication to lower fevers. So like not taking Tylenol to sneak your fever down below 100.4. So as you can see, you know, this is not as straightforward as we'd like it to be. Fortunately, my background in public health helps me with this a little bit, but I really do understand if there's confusion. So a lot of my quest the past 3 weeks is we've kind of seen the virus notch up and there be more exposures and cases throughout the state is really communicating. The biggest threat is actually the households of your athletes. And two, it's that 2-day period prior to becoming symptomatic for those who end up getting positive, where they are considered infectious and nobody knows it. So there's nothing you can do, there's nothing I can do, there's nothing anybody can do about this, except for nip it in the butt when it happens, and we have to mitigate the transmission of the virus. And you know, whether it's you're concerned about mitigating the virus for the health of all your athletes, or just not getting on the front newspaper page where you're the basketball team that had 7 cases out of 15 kids. So there, you know, there's a lot of motivations here, but cases are becoming more prevalent. I think some of you may have heard this term called community spread. What it's a measurement tool of every single case, they interview the person who gets it at MDH. They try to figure out how they got it. If they can't figure out how they got it, point to a specific person or event, and they put a question mark in the box. That's community spread. So it's cases of unknown origin. Well, in Minnesota right now, we have about 35 to 40% of our cases. Those individuals have no idea how they got it. Now, I'm sure there's a small population of them that just aren't cooperating with the contact tracers, kind of leaving that, you know, inflating that number a little bit, where they might know how they got it, but they don't want to tell anybody. But still, that's a high number. And so knowing that, there's a lot of virus out there. Plan for buffer weeks. Make it very open, known to people that practices and games can be canceled on minutes notice. So that's a really important piece that I've seen working with youth sports organizations, the Department of Health, and the state on this.
Okay, Jayme, thank you. That's awesome. What I'd like everybody to do, I know it's pushing 7:30, and I told Jayme that I didn't want to have him stay on here for a long time, but does anybody have any questions? Please put it into your chat. I wanted to kind of bring something up just very briefly. Both Jayme and I don't have the specific answer to this, but we have been in discussion with Commissioner Tomes, and we're waiting to hear guidance from the youth sports perspective. If your school or district, for example, we just heard on Friday that Anoka Hennepin district is going full distance. We know that that's happened in St. Cloud, in Princeton, in Chisago, in other areas where that's happening. We know that initially that the recommendation is going to be you can practice, and correct me if I'm wrong, Jayme, you can practice in your community, but competition is going to be not recommended. So Jayme, if you want to add on to that part of it.
Yeah, and that's, you know, we've been really trying to figure this out because I know it's so important to youth sport operators, not only in terms of the facilities, but, you know, if we can actually operate. And what's going to be really hard to, you know, to figure out here is, you know, strongly recommended and required. It sounds like the recommendation is there's going to be that there's no games within those communities. Now, if that's going to be a requirement, I do not know. Again, I have a feeling And this isn't, I don't want to come off cynical, but we have an election in 9 days, and we have governors, and probably governors across the country are interested in how that election turns out. And they may be holding on to some guidelines that may actualize shortly after the election. So, I mean, in short, it's possible that the situation is getting worse, and no one's implementing a dial back or anything like that for political reasons. Now, I don't have anybody that's told me that. This is my political intuition. But I do know that the virus is, and I could be completely wrong, but we could still have the same result. We could still have a dial back or new guidelines pop out in the next month, purely because the virus keeps persisting at kind of a worrisome rate. You know, I mean, my home state of Iowa had 3 straight days of 50% positive rates. It's at all of our borders right now. That's another thing, the MDH, I asked them if there's anything they wanted me to communicate to everybody. They said be really, really mindful of bringing people in from out of state. It's not recommended to do it. You know, I understand that recommendation. I also understand the reality of being a sport operator. You know, at the National Sports Center, we hosted a big soccer tournament called the Fall Cup. We held it to 6 out-of-state teams, where typically we have about 40 or 50. So, you know, even me who knows the guidelines and works at a state facility understands that it's not always 100% every time. So do your best to limit out-of-state teams, understanding if you're on a border, it's, you know, maybe letting a team from out of state across the border to you makes more sense than making someone traverse across, you know, the whole state. But the recommendation is tournaments, try to keep it as local as possible or as regional as possible. If you can, get teams in and out of the building as quickly as possible after games. Try to limit that crossover number of people in the building, and you know, mind the existing guidelines, the preparedness plans. A lot of the times you'll be following the facility, what the facility has as their guidelines. 1, stick to those. 2, have your ducks in a row, have your preparedness plan ready and available to show to those who need to see it. If you have a tournament, if you are running a league, make sure everybody knows your guidelines. You know, 1, especially the players and coaches. If you're allowing spectators, 2, make sure they know it as well. I mean, being an indoor facility, they're going to need to be masked. You know, you're going to want to keep 12 feet of space between them and the playing surface. And, you know, you're going to, you know, keep them socially distanced as well, too. People in households can bunch together, but, you know, you don't want to let people in your space that exceed, you know, or that find themselves in less than 6-foot situations. You don't want to be cultivating an exposure situation. You know, ideally, if someone ends up testing positive, and this is when it works right, and they were symptomatic, and you're like, oh no, they were at the game. And then you find out they kept social distance the whole time. Everybody was more than 6 feet apart. Then you don't have to do anything. And that's the best case scenario here, that a case pops up, maybe on a periphery, and no one has to be self-isolated. Now, I get that it's most likely you'll run into it through athletes in their households, but that's just a nice piece to have, a nice tool to have in your pocket.
Jayme, will you just, and I know this is, we understand this, and I think everybody on this call for the most part gets it, that each district is different in how they're handling it as far as the number of spectators allowed within the facility at a given game time. But maybe just some general direction for people on where to turn to. I mean, I know they have to go to their district and speak to them on what they're allowing, but is there any generalities that you can pass along?
Oh man, honestly, this varies a lot between areas. You know, like, yeah, I'm sure some of you have heard this kind of 250 limit from people. I think in a basketball setting that'd be really hard to achieve, because The most important part, before you start getting into numbers and capacity, it's more of the concept. How well can you achieve that social distancing amongst everybody? And there's a lot of processes. So I would figure out your facility if they have a process in place to follow that. I mean, when we think of it at the sports center, we are most concerned with getting people in and out of our building. Honestly, when we have them in there, a lot of the protocols are pretty straightforward. People understand spacing, when they need masks, things of that nature. But trying to minimize crossover as much as possible is really important. So here's a good guideline. If you're in a facility that maybe they don't even really have a capacity or understanding, and you're trying to figure out in a spectator space, how many people can I fit in this area? The key number is 113 square feet. And 113 square feet is, and don't go back to geometry a little bit, it's a radius of 6 feet in a circle going all the way around. If you get in the whole mass of that, you know, the pi r squared stuff, it's 113 square feet. So if you have an area and you want to figure out how many spectators can I safely put in that area, figure out the square footage, multiply the length by the width of it. If it's 30 feet by 30 feet, so you got 600 feet, and then divide it by 113. And then you can figure out how many individuals I can safely give that 6 feet of space. So that's a good one too. Masks are going to be really important. You know, it's not a requirement, but it's becoming more and more recommended that, you know, masks on the sideline are important. And I see a lot of people look at this is like, this is binary, and as in, you know, it happens or it doesn't. After the fact, it might seem like that, but all right, so if I get all these kids playing basketball together, bumping up against each other, guarding each other, going a whole game, why do they have to be masked on the sideline or coming into the building? And it's not, you know, it could take just an instance to get it. It could take the 15 minutes. It could take the game, but it could also take just being on a bench next to somebody. We don't necessarily know where that point of transmission happens. And it's the thing we keep talking about in sports. It's the socialization of sport. So far, we have not seen a very minimal number of cases transmitted from team to team or person to person, specifically in a game setting. But we know that these individuals aren't just close to each other in these game settings. There's this whole socialization of sport. There's transportation, travel, meals. If they're older, they might be socially hanging out. Athletes hang out with athletes. I know all my best friends were all my football players. We all hung out together. We lifted weights together. We did everything together. And if we got something from each other, we might not definitively say that it came from sport, but we know that the more and more time you spend with someone, the opportunity grows. So yes, they're already exposing each other and already in close contact on the playing surface. But essentially, that's the trade-off we've all decided we're willing to risk. You know, that's what we're all doing this for. We want to play sport. We want to have competition. And while we're not in competition, once that whistle blows and the game's over and the horn blows, then we have to be safe. Or when we're not on the playing surface, do absolutely everything you can to minimize the opportunity for transmission. And if you are unlucky enough to get this virus, creeping around on your team, hopefully it was as minimal spread as possible. And if it was, you can point to, some of the risk mitigation strategies you followed and guidelines you followed throughout the process. And there's a big but at the end of that. And the big but is I've worked with groups who have done almost absolutely everything right, and they've gotten cases and transmission on their team. It's within that 48-hour time frame. They had no idea someone was even contagious, and that person didn't know they were contagious. I've seen other groups that don't do anything. No preparedness plan, no social distancing, held their event, and they got off scot-free. So there is an element of luck here. You know, being lucky is okay. I wouldn't bet on it though. So, you know, take all your risk mitigation strategies, follow your guidelines, maintain social distancing, mask in areas you're supposed to, minimize too much travel, be careful about the households of your athletes and the health of the individuals in those households, because that is about a step or, you know, a week away from possibly affecting your team. And I know it might not feel like it, but I would much rather be taking a 2-week break because we have 1 case and some exposures than taking a 2-week break because we have 8 cases on our team, and then possibly extending that timeline. You know, your athlete might have a sibling who's also an athlete, and you might be affecting their team too. So, you know, really be mindful of the households. I can't say it enough. It just seems to be the most vulnerable piece for you know, our teams and our organizations and sports as a whole.
Okay, we are approaching 7:40. Rebecca had a question, Jayme, kind of along the same lines. If a player has a household member test positive, but the player tests negative, does the rest of the team have to isolate for 14 days, or can they still play without the exposed player?
They can still play without the exposed player. So that's where it kind of becomes that two degrees of separation thing, where you have the household member who's positive, that they're, you know, patient 0 in this case. And then you have the exposed individual 1 degree away. You isolate that person until they actually become symptomatic and or test positive. You don't worry about exposing people next to them here. But again, you understand how this can flip on its head really quick. So you want to be on top of it and be aware, because the instant, you know, that household member or the athlete on your team, if they also tested positive, you need to be able to work backwards quickly. So anytime you get a case or anytime someone tells you that I may have been exposed or I may have COVID, your 2 questions are, when did you become symptomatic? And were you around the team within the 2 days before that? If the answer to that second question is yes, you have exposed team members. That's the way I kind of have to look at it. So a lot of people will come with a big story, and ideally, and this happens time to time, it was too far gone. It was 3 days ago or a week ago. You know, I was around someone who I know tested positive. When did they test positive? You know, I was around them last week. Well, you got to start investigating and figuring out when they became symptomatic and all who they were around within those 48 hours prior to becoming symptomatic.
So that kind of goes in line with what Ashley had said. If they're using a Google Doc for tracking contact tracing and attendance, or the GameDay Ready app, or TeamSnap has one. If the player checks has symptoms, or they circle yes to any of the questions, does practice need to be canceled? It kind of goes in line with what you just said.
Yeah. I mean, we got a unique situation there. I'm like, if I'm giving just a general mantra, it's just be cautious first. Always be cautious first. 2, if you have questions, you can email me. I'm going to enter my email there. And there is, Dawson, do you have that,
I'll put it on
MDH
here.
sport email? Okay. So then MDH has an email too that they share. Oddly enough, you might find your way back to me because they kick a lot of these questions over to me. MDH has been an absolute pleasure to work with, but and I don't mean this in a bad way. They're not all a bunch of big jocks like me and us. So it's having these, maybe how to communicate their message or understand it with some context is an easier conversation with myself than one of the senior scientists at MDH.
Okay.
You know, I went to grad school to study sport injuries. and found my way here. So that's, that's how I rub shoulders with all these intelligent people.
Does anybody have any other, if you want to openly unmute really quick and ask a question, you can, otherwise put it into the chat, but just a few more minutes with Jayme, because we want to make sure, I don't know if you had to put your child to bed already or if you have to still do that, Jayme, so.
I already did, but it is Sunday Night Football. I don't want to be trite, but I'm a big meathead. I can't help it.
Anybody have any other questions? Okay, and just so everybody understands, myself, Jeremy are in constant communication with Jayme, and we can't thank him enough for his willingness to work with us to make sure that what we are disseminating out is consistent and correct in the current stance and guidance of MDH. We are proud to be a part of the Youth Sports Task Force. The collection of organizations. We're meeting soon, I believe, to kind of come together again to try to make sure that there's consistency within sports. The MYS is working directly with Minnesota Hockey too, to try to have some consistent messaging as well as we move into the winter indoor sports. So I think it's very important that no matter what is going on, that it's disseminated factually, and there's open transparency, and we're very open about it as well when we're communicating this stuff out. So we are here, like Jeremy has said in all his correspondence and communication, everything that I've said, this is the reason why the Minnesota Youth Basketball Alliance was created. One of the big reasons to make sure there's consistency in communication. So no matter what part of the state of Minnesota you're in, that we can have consistency, and especially now with in the midst of a pandemic. So Jayme, anything else?
No, I think I'm pretty long-winded, but I think that's it.
Dawson, can I throw one at Jayme real quick?
Yeah.
So I guess I'm just curious on the school side of things. If we end up in, so like we're in a hybrid right now. If we end up moving to where secondaries in distance learning, but elementary is in hybrid, what is kind of the recommendation for facilities? Is it completely up to the district to make those decisions? So like our two places to practice is one of our elementaries and our middle school. And so we're just wondering if they they move to distance learning at the secondary level, or we would be out of that possible facility.
Yeah, I mean, that's a big question right now. And that's when Dawson and I have been working together to try to figure out, I mean, it appears, I mean, one, it's going to be up to the facility at a certain point. What happens in terms of the guidance, since it's not officially out or written, we do not know. We do not know if there would be an availability for, whether this is 100% hybrid, that's only when the cutoff would happen, or at what part of the threshold. If I'm a betting man, I think that you will be able to use these facilities unless it is 100% hybrid. I think we might get into this kind of recommended versus required language a little bit, where you may be able to, and it'll be up to the discretion of the facility or community ed or whomever is the renter. And that's how I see it coming. But honestly, Dawson's been working very hard on this answer, and everyone's swamped at the Capitol right now. I mean, we're trying to get the cabinet members and Department of Health people to give us a definitive answer, and they've been a little cagey. And every time they're cagey, it usually means they're working on something. So all we have is some informal communication that seems to suggest that there's not a recommendation for competition at the hybrid level. We didn't get an understanding of that means 100% hybrid, and whether that's just a recommended, and there will be some discretion up to that facility, or if it's just no. And that's kind of the world we live in with these guidelines, right, Dawson?
Yeah, and Jayme, you did mean 100% distance. I think you said hybrid.
100% hybrid, yeah.
And just so everybody understands too, when as with Jayme on the line still, we found this out really quickly, even with youth football, that or with when high school sports came back, that there is some strong guidelines with the Minnesota Department of Education, and there are some strong guidelines that the Minnesota Department of Health have as well, and those sometimes aren't always the same. But in this setting, especially with youth basketball, and because almost every one of you utilize district facilities, it's probably going to mesh more. And so we're going to have to make sure that we still get the verification or proper guidance from MDH on what their stance is that we can disseminate out. So we'll continue to get that answer. But Jesse, thanks for that additional question. So Jayme, thank you so much again for being on. We greatly appreciate it. And thank you for always having the bat phone on.
You bet. You bet. Good to talk to you all. And again, don't be afraid to email me if you have any questions. Always happy to help.
Okay. Thank you, Jayme. All right. So everyone, we're just going to take hopefully only another 15 minutes of your time. So a couple things to keep in mind, and I did put some links out there, but as of last week, probably I think it was Tuesday, Wednesday, Jeremy was able to send out kind of some updates on our safe play back to the hardwood guidelines. And as you noticed, there was a lot of things that Jayme discussed that we had updated within ours. As an example, like the thing that talked about per Minnesota Department of Health guidance, it is strongly recommended that spectators remain at least 12 feet away from the closest participant. We've heard 6 feet, 6 feet, 6 feet, but now they're talking about making sure that the spectators have a further distance from the people participating in the competition. Another thing to keep in mind is we have moved forward with a great relationship with the U.S. Council for Athletes Health, and we've been talking about the GameDay Ready app. I'll give Craig in just a minute a chance to kind of give a quick update on that. But they are also very helpful in creating some additional safety recommendations for Minnesota youth basketball that you all can use. And any of this stuff we want you to openly use. The safe play back to the hardwood guidelines, the recommendations. Rich Pennick, Associate Director at MYS, did a great job, and I did link it in the chat as well, did a great job going through some ideas related to event management and best practices as you're administering your event, things that we learned as we've administered events in the summer and the fall. So if you have things that from your perspective that you've gained knowledge of from your district that they feel strongly about that you maybe don't see in that link that I had put there, because I know that Scott had talked about some questions related to general guidelines. If there's some things that you don't see in there, feel free to email Rich at mys.org. Rich, are you still on right now?
I am, Dawson.
Okay. Do you have any other comments that you'd like to make about that document or anything else, just high level that you want to just pass along about guidelines and things like that within tournament administration?
Well, I think everything's going to be a fluid situation as we go throughout the year, and tournament directors are going to be able to have to, adjust on the fly, I think, because with all these things going on, you may have teams dropping out the day before your tournament and, trying to schedule your tournament, try to do it in a way to put pods of teams together to be able to get them into your facility and then back out of the facility as quickly and as fast as possible without having a lot of interaction with other groups coming in. But if you come up with ideas, you have anything that you would like to have us, add to the list and share with everybody, please email me and we'll definitely update that list as we go throughout the winter season.
Okay, thanks, Rich. So before I turn it over to Jeremy, because he's going to kind of give some housekeeping items related to the Minnesota Youth Basketball Alliance, I have just two quick things. One, I'm going to actually send it out probably tomorrow morning to the list of contacts for all of you, meaning all the MYBA member organizations. But if you are a tournament director, or if you're a director of an association and you guys run tournaments, which most of you do, late last week, the MYS did find out that that BallerTV, so the streaming service that has become very popular in the youth basketball and volleyball world, that they are going to provide MYBA member organizations a rockstar deal. So I know there's a lot of upfront expenses and costs that go into that option, and with everybody having the inability to have a large amount of spectators involved, there is the ability to do the subscription service on a weekend, and they're offering up a 50% donation back to the participating organization of the revenue brought in from event live stream. And that's basically you as the organization, your job is to get the individuals to volunteer at each court to run the equipment. They would send you the equipment, and it's your job as the host, if you want to take advantage of this, to have it streamed, and they will work with each organization on that. There is no upfront costs, except they're going to provide everybody a donation back. So that'll help you guys in your bottom line of running a tournament when you don't have the ability to do extra concessions or anything like that. So with this connection of these almost 120 youth basketball associations together, that's how that came into play. So we're excited about that, and I will send that out tomorrow morning to everybody. And then Craig Perry, are you on?
I am, Dawson.
Okay, so Craig, if you want to just give a brief update on the U.S. Council for Athletes Health COVID care package, just so everybody knows. We've obviously sent this out multiple times. We know that all the districts or the facilities are asking for everybody to do their due diligence with making sure that they follow through on contact tracing along with attendance. I just want you to, again, high level, just quick rundown on
Sure.
what we've got going on.
Yep, so we've had a number of youth basketball organizations join with us, and when they do that, we build an entire platform for them and help them manage their dashboard. So it's as simple as just logging into your dashboard to see your daily screenings. And the partnership also brings this, is that you have access to all of our experts, whether it's questions about event management and safety protocols for your tournaments, or if you have an outbreak or a positive test, you have access to our crew of people who will help you work through it and make sure you're following all the proper protocols. And just to give you an idea of who our experts are, Dr. Jim Borchers is the chair of the Big Ten's Return to Participation Committee. He's our president. Dr. Doug Ackerman is the chair of the Pac-12's Return to Participation Committee. So he's another vice president with our company. And then we have a doctor here in the Twin Cities who just got out of the MBA bubble with the link. So we have those medical experts that have basically been immersed in COVID and policies and event management and just walking through what you do when you do have a positive exposure. So when you become a partner and use GameDay Ready app, and you also use our education platform, you have access to all of our people. And then any policies or participation guidelines you might have. I spent a lot of time with Dawson and his staff the last couple of weeks looking at participation guidelines, make sure they meet all the correct safety levels from the MDH and CDC, and just smart practices for participation. So those are the keys that I wanted to share with you, that not only do you get the daily screening at 75 cents a month per person, which is really 2.5 cents a day for the next 4 months, you get access to our experts who can help you review your policies, look at what you're going to do for your tournaments. And then again, if you have an outbreak or a positive test, we're there to help you through it. So things have been working well with Dawson and everyone at the MYS. And just to give you a final idea of the other groups we're working with, we are doing this with the NAIA, with the National Junior College Athletic Association. We've got a half dozen Division II conferences that we work with. And we've got a number of Power 5 schools individually that are partnering with us in this program. So The MYAS is the first youth organization to do this. We've got several others that are in the works right now, but we're happy to be working with your group, especially the Basketball Alliance, to help you have safe participation. And one of the things in my former job with the high school league, I'm still connected to a lot of the school people. And I reached out over the last couple of weeks, and Dawson and I have discussed this, is that when you have a plan like the Game Day Ready screening and you're using school facilities, that's going to enhance your opportunity to get into their buildings, because they're going to ask you what you're doing to make sure that you're safe, whether it's for a practice or a tournament. And if you do have tournaments, we work with you on your tournaments as well to make sure that you have safe protocols and you can screen everybody that's going to be coming in to participate. And you can go to those school districts and say, you know, we're working here, here's what we're using. We're using the Game Day Ready app, and everybody coming in will have daily screening to make sure that they're healthy and we can have a safe environment. So those are the things we've been working on the last couple of weeks. Dawson, anything else you can think of?
No, I just think, you know, I'm a basketball coach for 6th grade girls basketball at Irondale Basketball Association for my daughter. And they made the decision late last week, instead of doing their tracing through a Google Doc, that they're going to move forward with the Game Day Ready app. And I think it was very important for them to realize, because I had gotten word from one of the directors of the board saying that, you know what, instead of a shooting shirt this year, the safety is more important. And for $3 a player, we're going to do this instead of a shooting shirt this year. We're going to bypass that because of the importance of making sure that we provide a safe, positive, productive experience. So again, we understand that it's an extra expense, but it is something that typically would cost an organization a lot more. So Craig, I put your email down in there, and we'll continue to pass along the organizations that may have interest, or if you have questions, more detailed
Absolutely.
questions, Craig will be there and we'll be happy to assist. So thanks for hopping on, Craig.
Not a problem. Thanks to all of you for letting me join you today.
All right, thank you, Jeremy. So just last but not least, maybe an update on the MYBA, the connection to Tourney Machine, how things are coming along.
Thanks, so the big thing that I'm going to be touching on today is two things: Tourney Machine and getting your teams uploaded. The first component, Tourney Machine, we've got access given to all of the November tournament directors at this point. Tomorrow, me and a couple staff are going to create accounts and get everybody else at least through January. We're going to get those tournament directors access. So if you're a tournament director, got a tournament in December and or January, look for those emails to come. It'll have some login information along with some instructions on what to do once you log in to the Tourney Machine platform. And a big part of that Tourney Machine platform is selecting the right team accounts, as you'll see in those instructions. The other big component regarding referring to teams is that if you haven't put your teams into the MYBA portal, please do that as soon as possible. And when we say the MYBA portal, what we want you to do for those people that have access to that is go to the MYAS website, myas.org, click on the login button and log in as you normally would. And from there, once you log in, it should bring you right to the MYBA portal. One of the tabs across the top will say teams, and that's where you can enter your teams. And then what we do is we take those team submissions and dump those right into Tourney Machine. So the big thing right now is those tournament directors that are working on their tournament, you know, mainly the ones at this point that are running tournaments in November, they're trying to assign teams to their tournament, and they're not finding the list of teams in there for some associations. So it's very important. I know some associations had to push tryouts back. Some associations haven't even had tryouts yet. So as soon as you can, please get those teams loaded into the MYBA portal. If you're a tournament director, even if your tournament maybe isn't until January, February, at this point, what we would like you to do is reach out to all the associations that signed up teams and ask them to get you the properly structured team name for the teams that they signed up for your tournament. Because when you log into Tourney Machine and you're selecting teams, you know, for example, if there's a Spring Lake Park, if they put a bunch of teams into your tournament and they just said, we'll take a spot in 4A, 4B, 5A, and so on, when you get to that list in Tourney Machine, most likely those teams are going to be called Spring Lake Park B4 Blue. They're not going to have that A, B, or C next to them. So you'll have to know, do I put the blue team in the A division, or is it the white team, and that sort of thing. So I guess it kind of goes two ways. If you are a tournament director, like I said, reach out to the associations that signed up teams for your tournament and ask them to give you the properly structured team names. Or if you're one of the people on with your association that signed up teams for other people's tournament, maybe be a little proactive and send them your list of teams that you signed up in the properly naming structure. That'll help things move along. At this point, the vast majority of associations have put their teams into the MYBA portal. So thank you for doing that. But if you haven't yet and you're able to, please jump in there. Jesse, you had a question?
Yep. So we're we just had some tryouts on Saturday, and we have a couple more that are going on tomorrow. I'm just thinking about, so we have some kind of challenging issues on both sides as far as like our gym space has some issues, some guidelines with pod sizes, and
Okay.
so when we got into team splits, you know, we have a group that has like 23 or 20, yeah, 23. So rather than doing an 11 and a 12, which we didn't think was great development, and the issue of the pod sizes, we're thinking of having like an 8, 7, and an 8. However, we're also thinking like somewhere down the line, if, you know, say we have 2 kids who are in quarantine, then we might take like our middle group and say a couple of those girls would go with the upper, maybe some of the lowers would go with the lower. How does that work for registering those on your, you know, like they're going to be identified as a specific team, but then they're, you know, we're thinking of having some, you know, some kids possibly move from one to the other.
Yeah, thanks for asking that question, Jesse. And I assume it's going to be fairly common this year with everything that's going on. But at the root of it, it sounds like you're going to have 3 teams for that particular grade level. What I would do is go in there and create those 3 teams. As long as the base or the majority of those players are going to be sticking with each one of those teams, if they take a couple players from a different team, that's fine. So say the white team, which has 8 players to start out, maybe there's 2 that can't make it, but they borrow a couple players from the red team. The majority of that team is still the white team. So we realize it's going to cause maybe a few more issues once we get time for seeding for the tournament. But for the most part, that team is the white team. So go ahead and set them up that way at that tournament. We'd rather have it do it that way. We talked about, well, do we want them to create a new team, a new instance, a new, you know, since it's not that exact roster for that white team in this example. But what we came up with is that if the majority of those players are on that white team, still call it the white team, even though they brought some more over, and we'll have to deal with that once it comes time for seeding.
Thank you.
Yeah, and I know too, and one thing to let everybody know too is that we did extend or increase the team roster limit. In previous years, we've set that at 12 players per team, but this year we did bump that up to 15, just in case there's, you know, for this reason, you know, with maybe having kids, you know, trying to prepare for it. There were a couple associations that said they might be putting a little bit bigger roster sizes together. So we do allow up to 15 players per roster this year. Question from Lisa, are there concerns for listing kids' names within the website for legal purposes, or is this secure? What we have found out and what we do is when it comes time to list the rosters, we just do first name and last initial. We don't list out the full name. At this point, there aren't any rosters listed on our website, but at some point once we surpass that roster deadline, our plan is to post the team rosters on the MYBA page of the MYS website, just so we can have transparency with everybody being able to see who's on what team.
And just another quick note that, you know, the importance of getting all of your teams in, and I know it's a slower situation this year, and we're very understanding of that. We're trying to make sure to assist in the process of getting everything into the Tourney Machine kind of ecosystem, because again, what that does, and we don't know how many tournaments will be held this year, but no matter how many there are, we want to make sure that there is a full body of work for all the teams in Minnesota youth basketball. So we don't have to have individual teams inputting scores any longer. We can have hopefully a full body of work that gets pushed into trusted rankings at the completion of a weekend. So all the tournaments that are on a specific weekend would automatically get put into trusted rankings. There's going to be the ability for you to see both, if you are a B team that might play in a couple A tournaments, you'll have that ability to see both of how that team fared in both. But again, this year we're having to accelerate this process. We can't have in-person seating meetings. So our hope is that this is going to take care of the issue already for this year. Our plan was that this was going to happen no matter what, that we don't have to worry about doing the seating meetings that you all have known them to be. And I know that there is some major frustration at times, and we have those too. And we're hoping that this can alleviate that, because it's giving a true, I guess, reading on where people stand as a team, and then they can be seated appropriately, or at least gets them into a proper area that then could be seated online possibly.
Yeah, and a couple other quick things I'll mention about the MYBA. Inside that portal, within the next couple weeks, we hope to launch a few new things in there. One of them being a message board for different association leaders to communicate back and forth with each other. We'll preload it with some topics in there. You know, one maybe for Renegade All-Star teams, especially if they're from your community, to let people know about, or if there's teams that displayed poor sportsmanship at your tournament, stuff like that. We're going to make sure that there's a signature attached to every post or every response in there. Also, you're going to see a button where you can pay for the rest of your teams. You know, the initial registration for the MYBA was you paid for 4 teams at $30 each. That was $120. Within the next couple of weeks, you'll see a spot where you can pay for teams 5+ in there. And then also what we're going to do this year for Grade State is the only way to register for Grade State is going to be through that MYBA portal, where association leaders can go in, select the teams that are going to be playing, and register them all at once. We're working on trying to get something set up too with the associations that have credits from last year's state tournament, to give you a coupon code or something like that. So that credit could be taken off the amount owed for this next year's tournament. But thank you for everybody jumping in there and embracing it. It's been great to see, like Das said, we've got over 110 associations right now. And just stuff like this too is fantastic to see. And we appreciate you all for jumping on and taking the time.
So again, if anybody has any other questions, comments, concerns, you know, let us know now, or feel free to email us, Jeremy, Dawson, Rich, any of the MYS staff, and we're here for you. Mark, did you have something?
I did, yeah, real quick. So I logged into the MYBA portal and noticed we're from Stillwater, so our teams aren't listed. So I just go in and add the teams within that MYBA portal, and that'll all flow into the Tourney Machine then when we set it up. Is that correct?
Correct. Yep. So it's a little bit of a manual process that I have to do once they're entered into the MYBA portal. I get a notification, and then I basically copy and paste them into the Tourney Machine portal. So yeah, thank you for getting that done soon.
Okay, and then one follow-up question on that. So I've not used Tourney Machine before, but we have a tournament in December. So do I just log into the app through the Sports Engine login, and then we can set up everything through that mechanism? I haven't had a chance to dig into it too much yet. But.
Yep. So in the email that I send out, we're giving you your login information. There's going to be a lot of good detailed information in there as well. We've also had a couple of online webinars with the Tourney Machine staff, and we recorded the last one and put that up on our website. We've also got a pretty, we're building it out, but a pretty large resource of help guides on how to use Tourney Machine. But essentially, I'm going to ensure that you have everything you need, you're able to access everything you need in Tourney Machine, and that from the scheduling standpoint, that everything goes well with your tournament. So like I said, those December and January tournaments, you're going to get the email tomorrow by end of day, giving you your login information and instruction, and we can go from there. Looks like DAS posted the link to the Tourney Machine webinar, but we've also got the additional help guides posted. Like I said, if you go to MYS.org, click on the big MYBA button, and from there you want to click on Tourney Machine, and you can view those help guides from there.
All right, thank you.
You're welcome.
All right, well, it's 8:14, so I think we will end this Q&A and the latest outreach that we did. Again, do not be bashful. Make sure you send comments, questions, concerns to us. If we don't know the answer related to anything COVID related, we will make sure to get you the answer. And obviously, if you are asking that question, there's others in the Minnesota youth basketball community that are doing the same thing, that need the same answer. So thank you for your time and dedication to youth basketball. Have a good rest of your evening, and we'll be in touch very soon.